What led you to do your project? As medical professionals, we were inquisitive of students' understanding of nutrition and kitchen safety, specifically in the special needs population. Nutrition plays a role in health and well-being, thus having a basic understanding of these concepts can aid in healthy growth and development. Children tend to gravitate more towards foods with artificial and processed sugars, so we wanted to show them how much sugar is suggested daily. In addition, we wanted to teach the benefits of healthy fruits and vegetables, as well as show students that these foods can still taste very good. As students get older and help their parents in the kitchen, we thought it was vital to teach them proper etiquette, technique, and safety when using knives. And lastly, as medical professionals, we value the health and safety of the next generation, so we wanted to be on the front lines teaching these students how to actively live a healthy lifestyle.
Our project was completed over one day from 9 a.m. to 3 p.m. and had 3 distinct stages. Stage 1 was the pre-workshop where we met with school faculty, staff, and classroom facilitators to obtain clearance, discuss the day's format, station layout and flow, and overall goals. We talked about how classroom facilitators would divide students into groups, administer and assist students in completing the pre-assessment worksheets, and help students progress through each station. Because the number of students present in the classroom at any given time remained fluid, we anticipated having groups of about 2 to 5 progress throughout the day. After setup of each station, we discussed the best ways to maximize student participation. For example, since the sugar lesson required a great deal of student interaction, we wanted to ensure our nonverbal students could participate fully, so we made ad hoc modification in response systems to include written communication in the form of dry erase boards and markers. In stage 2, students began rotation through the actual 5-station workshop. We began at Station 1, where classroom facilitators administered and assisted with the completion of the pre-assessment MyPlate worksheet. Once complete, facilitators helped students progress to Station 2, which was the knife and food safety lesson, followed by the sugar lesson at Station 3, healthy smoothie lesson at Station 4, and post-assessment MyPlate worksheet at Station 5, where again facilitators would assist students in filling out their worksheets. Throughout the course of the workshop, we noticed that although we had used the teach-back method during each station, we wanted to better gauge how students were retaining information from their prior posts. So with every new group who arrived, we asked each student to teach us one thing they had learned or enjoyed from their prior station. We repeated this for the current station they were in before leaving, and found by the time they arrived at the last, they were able to articulate things they had learned earlier that day. We ended the day at Stage 3, the post-workshop debriefing. Here, as project coordinators discussed the subjective and objective results of the day. Additionally, we elicited the input of school faculty and staff in sharing their thoughts and student feedback.
Some of our most interesting findings had to do with age group differences. For example, students of all grades understood hand hygiene. However, knife safety knowledge and knowledge about first aid in the kitchen only increased with age. Students of all grades successfully identified which food had more sugar in it. However, they consistently underestimated how much sugar was in the high sugar item. In terms of making the smoothies, younger students were less likely to try the healthy smoothies because of the ingredients or the colors, but the older students were excited and they expressed a desire to make the smoothies at home. Importantly, the small workshop setting allowed us to individualize the learning for each student, and when we met with the staff of the special needs department post-workshop, they found the workshop interactive, educational, and voiced an interest in future workshops.
Most people know that healthy eating will lead to a healthier life, but some people may not know that. So our project has impacted our CHC by promoting healthy eating and kitchen safety in children who might not have developed those skills in their home, especially if they have disabilities where they might not learn these skills as easily. By promoting healthy eating in children now, it will set them up for a life of less disease and comorbidities associated with unhealthy eating. The children may also take this information to their homes and to their families, and that can help influence their caregivers to make healthier grocery purchases, which can lead to a healthier life for the children and also their families.
After the workshop, we met with the teachers and the staff of the special needs program. We asked them questions and evaluated their thoughts, all of which found the workshop to be interactive, educational, and fun for the students. The staff voiced their interest in continued health studies education and have been in contact about future workshops. Future health education workshops will lead to a stronger understanding of how diet and kitchen safety can affect one's health.
Our project demonstrates that interactive, level-appropriate activities can engage students and teach them multifaceted lessons about nutrition and kitchen safety. This can serve as a framework for developing similar programs in other organizations, but can also be tailored to reflect their community needs. Therefore, prior to replication, discussions and needs assessments with community schools and special needs programs would be necessary. The staff who works closely with the students is vital throughout the process of planning, implementation, and interpreting results of the workshop to best meet the needs of the students. Our workshop was for about 6 hours during one school day. Discussions with the intervention specialists and staff after the workshop concluded that students would benefit from having continued workshops. By having these repeated workshops or integration of the workshops into classroom learning, it would reinforce the nutrition and kitchen safety lessons. Students would keep learning, developing their skills, and increasing their self-efficacy and empowerment in the kitchen.
Given the unique population that we decided to work with, it was hard to find existing studies that we could use to guide our own study. Thankfully, prior to the workshop, we were able to closely work with the intervention specialist at St. Williams, sift through our proposals, and decide what would and would not work. Future studies would definitely benefit from this close interaction with special needs experts. During the workshop, since we worked with all grade levels and disabilities, we ran into problems with varied levels of engagement, with the older students generally more engaged and able to stay on task. In addition, since this project was done during school hours, the students were still required to move between classes, which interrupted the desired workshop flow and impacted the availability of the students for pre- and post-test evaluations. Further workshops could be refined to include narrower age groups to get a more accurate assessment of how student knowledge actually grows. In addition, further workshops should work to set aside time outside of school hours to avoid rotation scheduling problems.
Our workshop demonstrates that interactive, level-appropriate activities can successfully engage students and teach multifaceted lessons about nutrition and kitchen safety. Workshop interactions demonstrated that students were enthusiastic, able to incorporate learning with hands-on activities, and tie that knowledge into their daily lives. Activities with the most impact included visual representations and active participation, and a small workshop setting was important for a learning experience that was tailored to each student. Our project addressed several community needs. These included the multiple factors that contribute to the rising rates of childhood and adult obesity, the importance of supporting the needs of students in special education programs who might otherwise be excluded from nutrition and first aid educational workshops in the classroom, and supporting individual empowerment and knowledge regarding nutrition and safety. The community-oriented interprofessional development of our workshop can be used as a framework for developing similar programs in other organizations, while activities can be tailored to reflect individual community needs.
Hi, my name is Moizz, and I'm a second-year osteopathic medical student. I will be discussing the implications for future research. Our project can serve as an innovative model of interprofessional collaboration between the health professions and special needs programs on educational workshops tailored to the needs of the community. Our project demonstrated that intervention on nutrition and first aid is engaging and practical for the student health and well-being by establishing self-efficacy and targeting diabetes and obesity prevention. Based upon feedback and experience, some improvements that might be necessary are more consistency, peer engagement, and interprofessional communication. In addition, some more topics that could be addressed are reading and understanding food labels, proper food storage, recognizing spoiled food and expired items, and kitchen appliance operation.